All right, today we're tackling one of the most dreaded injuries in all of sports, the ACL tear. But we're not just going to talk about the injury itself. We're going to dive deep into a very specific, science-backed way to recover that doesn't involve going under the knife. If you're an athlete, you know the feeling. You hear that pop, you feel that awful instability in your knee, and your entire season just flashes before your eyes. It feels like a career-changing moment. So the question is, what do you do next?
Well, for years and years, the playbook has been pretty much automatic, right? Especially if you play a sport that involves a lot of cutting and pivoting. ACL reconstruction has always been treated as the gold standard. The only real, reliable way to get stable and get back out there.
But what if that's not the whole story? What if that conventional wisdom needs a second look? What if, for a very specific, carefully identified group of people, there's another path forward that's just as valid and just as backed by science? Well, that's exactly what we're going to get into.
Okay, so let's dig in. To really understand this non-surgical option, we first have to bust what you could call the ACL myth. We've got to look at why surgery isn't always the guaranteed silver bullet that everyone seems to think it is.
This whole conversation isn't some new fad. Not at all. This idea has been kicking around in the research for decades. All the way back in 1983, 1983, researchers came up with this rule of thirds, suggesting that about a third of people with a torn ACL could probably get back to high-level sports without their knee constantly giving way, and do it all without surgery.
And if we fast forward to today, modern research really highlights why we need other options. The reality is, even after surgery, we're seeing re-injury rates that are higher than you'd think, return to sport rates that are honestly kind of low, and a lot of people still develop arthritis down the road, whether they had the surgery or not. So the bottom line is, a reconstruction doesn't just magically wipe the slate clean. So that leads to the million-dollar question, doesn't it? If surgery isn't a 100% guarantee, then who are these people who can actually succeed without it? Well, it's time to introduce the star of our show today, the potential coper.
Now, a potential coper is not just someone who says their knee feels okay. Nope, it's a very specific clinical term. It means a patient who has gone through a really comprehensive screening process and is identified as having the real potential to get back to sports like basketball or soccer while technically still not having an ACL. This is a scientific classification, not just a lucky guess.
So how do you find these potential copers? It's definitely not based on a gut feeling. It all comes down to a systematic, evidence-based screening process. Let's break down this really tough 4-part test.
Okay, so this screening has 4 big hurdles you have to clear. First, you have to perform 4 different single-leg hop tests, and your injured leg has to perform it over 80% of your good leg. Second, since the injury, you can't have had more than one single episode of your knee buckling or giving way. Then, you have to score really high on 2 different questionnaires about your knee's function. And here's the kicker. You can't just pass 1 or 2. You have to nail all 4 criteria to be considered a coper.
And just to give you some perspective on how selective this is, check this out. A major 10-year study found that over half the people with an ACL tear couldn't even take the screening test because they had other damage, like to their meniscus. Of those who could take it, more people failed it than passed. In the end, only about 20%, 1 in 5, of the total group were identified as potential copers. So this really is not a path for everyone.
Okay, so let's say you passed the test. You're one of the few who qualifies as a potential candidate. You still have a choice to make. The non-surgical route isn't just one thing. It actually splits into 2 different paths, and it all depends on your goals. On one side, you have activity modification. This is a great choice for people who are happy to stick with straight-line activities. Think jogging, swimming, cycling. The rehab focuses on getting you strong for everyday life and those activities. But on the other side is the return to sport path. This is the really demanding route for those potential copers we've been talking about. This requires an incredibly systematic, tough, multi-phase rehab program to build that high-level stability you need for cutting and pivoting. For the rest of this explainer, we're going to follow that second, much more demanding path. Let's walk through what the road to recovery actually looks like for someone who's been identified as a potential coper and wants to get back in the game. It all starts right after the injury, in what's called the acute phase. The goals here are pretty basic, but they are absolutely critical. First, you've got to get that initial major swelling under control. Second, you need to get your full range of motion back, meaning your knee can go fully straight and bend all the way.
And third, this one is huge, you have to reactivate your quad muscle, which is notorious for just shutting down after a big knee injury.
To help fight that quad shutdown, physical therapists use tools just like this. It's called neuromuscular electric stimulation, or NMES. It's basically a way to use a safe electrical current to help the muscle contract. Think of it like a jump start for your quad to get it firing properly again, right from the very beginning of rehab.
So once that initial swelling and pain are under control, you move into phase 2, neuromuscular training. The best way to think about this is that you're literally retraining your knee's reflexes. Without an ACL, your muscles and your nerves have to learn how to provide that stability on their own. And you do this through tons of advanced balance work and a special technique called perturbation training, where your body is challenged with unexpected pushes and pulls to teach it how to react instantly.
So, you've built the foundation, you've retrained the whole system, now comes the final hurdle. And I want you to focus on this word, earning. You have to earn the right to return to your sport. This isn't about a date on the calendar, it's about meeting objective, measurable goals to prove that you're ready.
Before anyone clears you to play, you have to pass a whole battery of final tests. This means your quad and hamstring strength has to be over 90% as strong as your uninjured leg. Your scores on all those hop tests, they also have to be over that 90% mark. You have to show that you can move symmetrically and with control during dynamic tasks. And, crucially, you have to be psychologically ready and confident enough to go back out and compete without fear.
So, what's the big takeaway from all this? If there's one thing you remember, let it be this. Non-operative treatment is not a passive wait-and-see approach. It is an active, demanding, science-driven rehab program that requires an incredible amount of commitment and hard work from the patient.
And that really leaves us with a final, provocative question. We know surgery isn't a perfect fix, and we know this tough, non-operative path can be successful for a select few. So maybe it's time we reframe the whole conversation. For the right patient, the one identified through all that screening, should this non-operative path be the first option we discuss, instead of the alternative we only consider as a last resort? Something to think about. Thanks for joining us.